Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator for today, Ms. Rose LeMay, Director of Northern and Indigenous Health at the Canadian Foundation for Healthcare Improvement. Please go ahead, Ms. LeMay.
Thank you. Hello and welcome to today's webinar on the First Nations Health Managers Association. We are pleased to provide simultaneous translation for our on-call webinars. This may result in a few quick pauses in the dialogue today. As mentioned, I am Rose LeMay. I am joined in our studio by Joanne Daniels, Improvement Lead here, as well as our producers for today's webinar, Kelly Ripley and Sheena Powell. I welcome you all to on the line today. As I introduce our guest speaker, please take a moment to introduce yourselves in the chat box. Who you are, what organization you're from. If you're in a boardroom with multiple people, please note this in your introduction. Our presenter today is Marian Crowe, the Founding Executive Director from the First Nations Health Managers Association. Marian Crowe is from the Piapot First Nation in Saskatchewan with experience in Health Canada and the First Nations and Inuit Health Branch. She has extensive experience across program development, health systems policy, health human resources, and financial management. Assisting community members in the development of professional development opportunities and certification has always been a keen interest to Marian, as she was the founding board of director on the board for the Saskatchewan chapter of the Aboriginal Financial Officers Association. Marian has been awarded achievement milestones and as recently was honored to receive the 2015 Xerox Canada AFOA Excellence in Aboriginal Leadership National Award. This webinar is part of CFHI's new recommended learning journey on Indigenous health. In addition to this webinar, we will share with you some future webinars coming up that will make up part of our recommended learning journey on Indigenous health. Today, we'll learn about how the First Nation Health Managers Association supports professional development, networking, and research for health managers. Throughout the webinar, you are invited to type questions and comments in either official language into the chat box on the right hand of your screen. Once Marian has completed her presentation, we will look to answer as many of the questions that you share with us. Any questions that we don't answer today, we will address via email after the webinar, and of course, you can always follow up with us online. With that introduction, now I'd like to hand it over to Marian Crowe from the First Nation Health Managers Association.
Thanks, Rose. Really appreciate the kind introduction. And I'd like to start, too, by just letting our participants online know that I am a certified First Nation Health Manager. That's what the acronym is behind my name. It's the designation awarded to people within the First Nation Health Managers Association who have completed the requirements for the designation. I'd also like to point out at this time that Rose LeMay is also a certified First Nation Health Manager with our organization, and we're really excited that Rose leads by example and carries the designation on our behalf. It's quite an honor. So I want to start on the first slide that talks about what the First Nation Health Managers Association is. And essentially, we're a First Nation organization that represents health directors and health managers from across Canada, coast to coast. And we provide a supporting role in their certification and in their professional development. So we're the organization nationally that is responsible for providing training, certification, and professional opportunities in First Nation health management from across Canada. I'll tell you a little bit about First Nation Health Managers Association. I want to first point out that the acronym is FNHMA. So if you hear me say FNHMA, I'm referring to the First Nation Health Managers Association, and we tend to speak in a lot of acronyms in First Nation health and specifically in First Nations overall. So I apologize and point it out now that FNHMA is our organization. So we really work hard at FNHMA to help promote and contribute to the advancement of First Nation health, and that's across Canada again. More specifically, we've developed a certification program that has led to the Certified First Nation Health Manager Professional Designation. And I do want to share here, and it's not on your slides, I just want to speak to it, that there's a real long history in the organization around having put together a program that doesn't currently exist in Canada. Rose actually has a long history in the building of and founding of our organization as well. We go back to 2005 actually, where the Assembly of First Nations and the First Nations and Inuit Health Branch, FNHMA, another acronym for you, got together and said that the Aboriginal Health Human Resources Initiative should be a priority, and as such, an advisory committee was put together, co-chaired by the AFN, the Assembly of First Nations, and FNHMA, with 10 health directors from across Canada, and their mandate was to put together competencies that health directors and managers sought for themselves, and also to develop and look at the building of an association for these health professionals, unregulated health professionals. Rose at the time contributed in her role as the Assistant Director of Health to the Assembly of First Nations in helping pull the competencies together and having them validated by over 1,100 delegates from across Canada. So thanks for your input into the history, Rose. It's definitely appreciated. So I want to come back now to the presentation here. I just wanted to give you a little bit of background on kind of how we got started, why it was important, and really just to recap that First Nation health managers and directors wanted input into providing a competency skill set that they felt they should have in doing their day-to-day jobs. Much like any other health professional association, competencies was at the heart of how FNHMA was founded. So I think I've told you a little bit about our history, how we came to be. We're a young organization. We opened our doors September of 2010, so not a lot of history yet, but some major achievements and milestones have occurred that I'll talk to you a little bit further in the presentation. So I want to actually go into who do we represent. And you'll notice here that there is a link that you can look at later, and we're going to walk you through it. It's a little bit more detailed, and I'm going to skim over the first 9, I believe, slides here. But I really brought this one out to show you who is a health director, what do they do, what's expected of them, and from there you can get an idea of how you can or cannot support them in your duties across Canada. And my apologies for that. I am a little under the weather, like most people are right now with a cold, so we'll just continue on. Who do we represent? We represent health directors and managers who work in First Nations communities. So these are on reserve. They work in community health centers from across Canada. They work in treatment centers. They are what you would call a CEO of health services that are delivered federally on reserve. They can also be equivalent to, they're also, people that work in MAT Child, diabetes, and any other health program that is delivered in our community. In this slide, we talk about the tasks according to their job descriptions. And, you know, we talk about job descriptions and scope of practice. I want to share with you what they feel their job duties are, what they really do, and you'll see quite a difference. Next slide. So in this, I took a job description from David McLaren, who is the Director of Health and Social, and you'll notice Health and Social quite often put together in First Nation communities under one umbrella. David McLaren is a certified First Nation health manager, and he is also our current vice president of the association. So he kindly let us borrow his job description and a day in the life of what his job looks like. So this is Eagle Village First Nation. Excuse me. You'll see that he works for a health portfolio holder, which is an elected position in First Nations, and in accordance with the policies adopted by his First Nation specifically, he has to plan and coordinate the control and activities of health and social services programs provided to all of Eagle Village First Nation members. Next slide. You'll see here in his duties that he's responsible for planning and directing and controlling all aspects of the delivery of services by health professionals. So there's some professionals such as nurses working under his direction. He also has programs such as Brighter Futures, National Native Drug and Alcohol, community health representatives, and other programs to ensure optimal use of resources for, I'm so sorry, for his community and members. In this role, he also is responsible for staying in close contact with his members of his community, families across communities, and he has to appreciate the needs and assess the quality of services provided by his government, the federal government, and any regional relationships that he has. Next slide. Not only is he responsible for all of that, but he also has to coordinate the budget preparation for all social services and health programs. He has to ensure that he has a good relationship with the government representatives and negotiates all funding agreements for the delivery of health services on reserve. He ensures that the facilities and equipment and documentation are quality and timely. And of course, he has to report to his council on trends that may impact the services that are offered in his community. So that's what his job description reads. It's fairly straightforward. It's an average community health director, vague job description. And of course, then there are the tasks that he is responsible for according to the community members that he serves. So they believe that he should review and authorize payments on all invoices. Of course, that's a part of his function. He should be doing periodical spot checks on workshop expenses, so looking for proof, as community members would say. He has to review all financial aspects of project proposals, negotiate jobs, rates of pay, and of course keep his community members reported to and make sure that they feel an ownership in the health services that he is delivering. He is to manage human resources for the Eagle Village First Nation Health Service Station as well. So this is contractual work, the staff meetings. He has to ensure that policies and procedures are up to date. He has to intervene on conflict resolution and discipline. And of course, time management validation. People want to know, what are you doing for the dollars that the health center is paying you? And of course, he has to ensure that he is meeting with all of the organizations and the partners that he has in delivering health services to his community. Some of those partners would include the Commission of Health and Social Services in Quebec, so the First Nations and Inuit and Labrador Health Services. He would also look to do meetings and partnership agreements with Health Canada, First Nations and Inuit Health Branch, any kind of Aboriginal health transition funded projects that he has, any local community task force that he may be working with, especially in light of health services integration being at the forefront recently. He'll want to ensure that he's working with a regional body as well to ensure services are delivered adequately. Of course, he's also having to do this while being culturally respectful to the practices of the First Nations at Eagle Village First Nation. So this means that he's aware of any community members who are practicing traditional methods. and has a role incorporating traditional and Western medication management to his community. Of course, he has a large role in working with the Crown, specifically the Quebec Health, First Nations and Inuit Health Branch of Health Canada. This means that he is reviewing and understanding his contribution agreements. He's involved with the communication for program orientation, and he has a regular role in ensuring that Health Canada knows what is being delivered on reserve at his organization. He also is responsible for the operations and maintenance, so of course this means that he has to ensure that the generators are working, that any kind of physical aspects of the workplace are up to code, which isn't always easy to do with limited resources. And he makes sure that medical equipment is there for his home care services. Okay, I'm going to lead you through an example of what his typical day looks like, and there's 3 days here that we're showing, so I'm just cognizant of time as well. But you'll take a look that he starts his day at 7 o'clock by paying some bills, requisitioning some checks. Yes, we still use check requisitioning in community. He'll follow up on his emails, he'll touch base with staff, and then he'll meet with one of his coordinators to review provincial funding proposals because, yes, as a First Nation health manager, you need to know both the federal and the provincial side of health service delivery, so it's a very complex role. He'll review the proposals that he's got for suicide prevention projects. He'll meet with his professional service delivery staff as well, such as community health nurses, home care nurses, community health representatives. He's got to look at 3 cases where medical transportation is questioned. He has to ensure that the vehicle repairs, and he has to have a meeting with the driver as well. And you can see this goes on where he discusses HR with a band manager, and his chief will need to information on a medical transportation case that maybe one of the community members is questioning. And he'll wrap up his day, not by just leaving the office, but going to participate in a workshop that's happening in his community. So the day in the life starts often at 7, but doesn't stop until late into the evening. A typical day, again, well, you can see he's looking at scope of practice with the community health nurse who's doing flu shots in the community. He's meeting with his chief, and why I really want to point out these kind of the typical day is because you see things from scope of practice to reporting to advising the community's elected officials, such as the chief, and ensuring that their election platforms are being met on the health side as well. So it's not always an easy situation. And I have to say, these people, we live in community when you're a certified First Nation health manager as well. So you have somebody coming to your door at 7, 8, 9 o'clock at night because you're right in the community, and often can be related to a client who is looking for health services as well. So you'll see that he ends his day after all of, his itemized items here, and he's late for supper, and he needs to stretch and skin 2 beaver and mink hides. So often, the community health director will play a role in the diet and nutrition aspects of the community as well, and do some hunting to support the community in feasts, and in this case he was just doing some skin stretches. So here's our cultural competency at play. On his typical day 3, he's working on the reporting to Health Canada, and I can share with you, having worked in Health Canada and reported to Health Canada, these are extensive and lengthy reports to complete. So you'll notice he's blocked an hour and a half of his day off for that. And of course, at the end of his day, he's meeting with his chief to inform her of some HR issues that have come up, and he's really trying to get out of the day before, getting out of the office before anything else can go wrong. So a typical day in the life of a community health director across Canada. And of course, this is the gentleman I'm referring to, and I'm not sure that you can see these slides. that you'll have access. This is Mr. David McLaren, Certified First Nation Health Manager and Vice President of the First Nation Health Managers Association, practicing his self-care and fishing for his community. And I thought, what an appropriate way to wrap up what a health director does, because he also contributes back to his community in terms of feeding them. So I'm going to let you know that our organization is governed by a board of directors. So you'll see that we have a president who is representing Alberta as well, Lorraine Musqua, and you can go down and you'll see that every region across Canada is represented on the board, with the exception of our Yukon region. We actually do not have any members from Yukon yet. And I just want to remind you that we're only 5 years young right now, so we're still working on our outreach, but this is what our governance looks like. So if you know of any of those names, you'll know that they help govern the board. Partnerships. I want to talk a little bit about partnerships the organization has been able to complete in the last 5 years. One being with the AFN, that's the Assembly of First Nations. That was an important partnership for the organization because the association was born out of an advisory committee with the AFN and FNHMA. So there is a partnership agreement that outlines how we communicate with each other. There is also, out of the partnership agreement, 3 Chiefs resolutions that have been passed. And I'm not sure if you know much about the Assembly of First Nations and how they practice, but chiefs from across Canada gather twice a year, and at those times resolutions are put forward. We've had 3 related to the First Nation Health Managers Association, one supporting the organization, one supporting the competency framework in which we put out all of our courses founded on. And the other resolution that was put forward recently in July was that the chiefs passed a resolution saying that the Certified First Nation Health Manager designation would be looked at as the preferred credential when they're hiring health directors and managers in their communities. So it's quite a significant partnership to have with the organization. The other organizations we have partnership relationships with as well, so that we can look at career laddering between their organizations and our organization. For example, with the Aboriginal Financial Officers Association of Canada, we have a partnership agreement that says we use their financial management practices that they developed so that there is continuity between the organizations. Indigenous Certification Board of Canada is there, and the Thunderbird Partnership Foundation is also listed. And I just want to point out that Thunderbird Partnership Foundation is one of your upcoming presentations under this series. So I encourage you to log into Carol Hopkins when she presents on her day. I want to share a couple of stats with you now. And you can see here we're approximately 300 members strong. That includes Rose and myself as Certified First Nation Health Manager members. We have 86 Certified First Nation Health Managers from across Canada right now. In terms of industry standard, AFOA, the Aboriginal Financial Officers Association, has set the bar, and they were not at this point at 5 years in their organization. So we're ahead of the curve there. We've been able to put on 5 national conferences with approximately 2,000 delegates over the last 5 years. We have 4 toolkit publications, a textbook that we've put together. The textbook I want to share with you is 95% completed by Certified First Nation Health Managers themselves. We have 11 workshops that I'll talk about in a moment, and just to give you an idea of how busy our uptake is, last fall our enrollment was over 80 students for the online program. If someone were interested in becoming a member of FNHMA, these are what the benefits look like, and for the most part, you get a significant discount on the services. So your tuition and your workshops would be offered to you at a reduced rate. And we now offer a corporate membership for FNHMA as well, which will give you access to information such as our newsletters, direct email, and inform our members about your organization through a direct email. Like any other professional association, we're founded with professional standards, and you can see those there. What I want to point out is our competency standards for the organization, and these are the 10 core competencies in which we look at measurement when somebody's looking for the Certified First Nation Health Manager designation. So you'll see their leadership and governance, professionalism. Most of these are business administration functions. We've added in the health services delivery component that's relevant to how people deliver services in First Nations across Canada. So a lot of information about the federal government role and some pieces on regional health authorities in the province under health services delivery. But what makes us unique is the cultural awareness component. So when we're assessing on the competency standards and we see cultural awareness, people will say, how do you certify cultural awareness? That's quite often a question I get. And it's not about certifying cultural awareness or practice. It's ensuring that the person who's up for the certification is aware of the culture within the community that they're working in. So I just wanted to kind of touch on that briefly. Like any other organization, we have ethical standards as well. We also have certification standards, and I'm going to spend about 5 minutes talking to you about the certification standards. There are two ways that we look at obtaining certification. There are two different pathways and entrance requirements to the certification for FNHMA. One that talks about the regular path and a prior learning and recognition path. We also have the professional program. It's 5 courses we'll get to in a moment. And of course we have a maintenance of certification as well. So Rose, you're a Certified First Nation Health Manager. I'm a Certified First Nation Health Manager. What does that mean? It means that we've proven to First Nation Health Managers Association that we're highly skilled professionals in our area. We're committed to professional career development. We abide by a standard of ethical conduct. We're experts in First Nation health management, and we're valued for our health management expertise, and we're often a source of interpreters on health management, on health issues and health management matters. A Certified First Nation Health Manager can also help improve in the decision-making process and is a recognized and valued stakeholder for health service integration projects. Here's the 2 paths that a person can complete to become certified. Certified, not certifiable, a little joke there. Seeing if anyone's still listening. You can do the regular path to certification, which is enrolling in 5 courses that the organization has put forward, or you can go through the prior learning assessment and recognition program that demonstrates that you have 7 years or more in health management experience in a First Nation organization. You have to complete a competency self-assessment based on those 10 core competencies that I showed you earlier. And then you can put together a portfolio that is put forward, and we would review to see if you meet the certification standards. I think I've talked a little bit about this already, so we'll just move to the next slide. PLAR is something I know many industries have a PLAR program, so I'm not going to go into this history because I think you know it already. What I do want to point out, though, is why it was important for FNHMA to have a PLAR program. And we really wanted to recognize and give merit to the years and the journeys that health directors have played before we talked about certification. So it's a way of honoring and recognizing the roles for health directors in the community if they had 7 years or more. So because there's a lot of health directors in the community that may not have formal education, so to speak, not to say they don't, there's some people with master's programs that are certified. This is a way of honoring what they have put together collectively over their career. If a person were to go through the Plower Program, Rose and I went through our certification this way. We had to complete the self-assessment to prepare for our readiness. We had to put together our resume, job descriptions, educational information, and of course evidence to show that we meet certification. Then we submitted that portfolio to the organization and it was assessed. For people assessing the portfolio, we have assessors who are experienced professionals. They come to FNHMA with quite lengthy health careers in First Nations specifically, and they're people who look for evidence without bias from the candidates to make sure that they have at least 80% of the FNHMA competencies required. Now, the regular path, if you are looking at taking the courses, there are 5 courses to complete. These 5 courses excuse me, are made up of the 10 core competency domains that I referred to earlier. So the courses to complete the Certified First Nation Health Management Program are Course 100, Health Issues and Systems, Leadership and Strategy, Health Management Services, both 1 and 2, and then we round up the course with Professionalism, Ethics, and Cultural Awareness. And there is a requirement to complete a final exam as well. Just to give you an idea of what the courses cover, I wanted to give you what the learning objectives are. And these are not in detail. This is globally what we touch upon in Course 100, Health Issues and Systems. I do want to share that this is a really popular course for the organization. Not only do we see people interested in the designation wanting to take this course, but we also have people who work from regional health authorities, local health integration networks, and partners who work with First Nations or serve First Nations interested in this course because we talk about the history, we talk about policy that has influenced First Nation health service delivery. You'll see here too systems and programs in terms of how do First Nations navigate the system of federal jurisdiction health delivery. Epidemiology, determinants we talk about globally, but also the First Nation health determinants. Health governance is really popular within this course as well, because then people understand what it looks like on community in terms of reporting. There's not always a board or a committee that will govern the health governance in a community. So we talk about that. We talk about issues facing First Nations and future directions. So I spent a little time on Course 100 just because I know that this is our most popular course. Course 200 is Leadership and Strategy. As you can see from the list there, it's quite extensive, but mostly it's on the organizational side. Now if we go to Course 300, this is the health management piece. So we start talking about community needs and programs, benchmarking, health services accreditation is briefly introduced when we talk about quality improvement. And in 400 is health management again, more so though on the financial management, funding pieces, and HR. So a lot of reporting pieces within the 400 course. And we do talk about technology and information management with knowledge management as well. And then of course, Course 500, as I mentioned earlier, brings it all together, and it talks more about the culture of the community. We talk about healthcare and cultures, professionalism. This is where our code of conduct would come into place. We talk about self-care and everyone working in health, we're the worst for practicing self-care. I'm telling you, it's something that we really need to prioritize, and especially within a First Nation context. And I say that because, again, these are health professionals that live and work in the community, and they don't often not answer the door, don't answer the phone, they don't work the typical 8 to 5. So self-care is something that we really put an emphasis on. Once a person is certified, much like other professional associations, there is a maintenance of certification. So you're looking at 20 hours of continuing professional development each year to ensure that you're still up to date and current on First Nation health management and practices. We do support professional development in terms of putting together the program that we just walked you through. We do have an annual conference every year where we bring together 350 to 500 First Nation health leaders from across Canada. This year, in case you're interested, I have to give you a save the date. It's November 15th to 17th in Vancouver at the Hyatt Regency. And of course, we have publications put together, a textbook, and a knowledge circle. And I want to tell you a little bit about the knowledge circle. The knowledge circle is on our website, and then that's www.fnhma.ca. And in our knowledge circle, you'll find promising practices, tools and templates to help health directors do their work, and also supports and information from other outside organizations. This is a listing of the workshops that we've been able to put together over the last couple of years. And while we have been open since September 2010, the certification program has only been in practice for 3.5 years. So this is some of the work we've done in 3.5 years on things to help our members and also any partners wanting to support members of our organization as well. In terms of looking forward as an organization, what I really wanted to point out here is that when we look at the age of health services integration, when we look at, say, for example, what's happening in British Columbia with the historical tripartite agreement that was signed for the devolution of the First Nations and Inuit Health Branch, this is where FNHMA feels they play a role. We need to assist members in being the best health professionals they can be when they're taking on the transfer of health services from federal to their own health services. And I do believe you're going to learn more about this historic transfer at another upcoming webinar with BC. So just a note to mark your calendar, because that is quite significant and historic, and it's what other regions are looking to do in the future. We can also help your staff in terms of your organization support the capacity development of First Nation health and our leaders across Canada. We can support training and professional development in health governance. We obviously work with First Nation health organizations and education institutions on career laddering and consistency in training. At this note, I just wanted to say a bit about the educational institutions, because some people have said, it's great that you're a First Nations, by First Nations organization, that you're relevant, that your curriculum is something that you can apply right away in the community. Except I do want to note that we are working on formalized agreements with education institutions in various regions. Right now we do have an agreement with University of Saskatchewan academic institutions that actually recognizes 15 credits to their programs when somebody comes in with a Certified First Nation Health Manager designation. And of course, like any other professional organization, we're committed to lifelong learning with our partners and our membership. And at this time, I'd like to ask Rose if you have anything further to add. Before I pass it, Rose, one thing I do want to point out too is, just forgot in my notes here, we did do a number of intensive training sessions. So when you're looking at taking the courses, you can do them online, courses 100 to 500, online or intensively. We've been doing a lot of work intensively, meaning that people come together for a week. They learn 10 lessons over the course of 5 days with pre-readings, an on-site assignment, and post-readings and post-assignments. And they come together as a collection. And so we've seen this in Saskatchewan, in Manitoba, and Quebec, where health directors have come together. They've been supported by the First Nations and Inuit Health Branch in terms of financially to come to the course. And they're learning from on-site instruction. They're learning from being in a cohort of their peers together. And so we're finding the trend actually is that people are much more successful in the intensive delivery method. And it's a method, like I mentioned earlier, that Saskatchewan and Manitoba and Quebec have been supporting. And actually, we did present to all the regional executives of the First Nations and Inuit Health Branch a couple of weeks ago, and Dr. Pam Smith, who's the regional executive for Manitoba, said that her staff are reporting seeing significant increases in the partnership between the health directors that have gone through the training and those that have not. So they're already seeing the demonstrated ROI for their region on their certified First Nation health managers. Rose?
Yeah, so thank you very much, Marian. At this time, we'd like to hear any questions or comments for participants. Please type them in the chat box as you think of them. I have a couple of questions just to start off, and I'm interested, I think you mentioned that you have a textbook. Mm-hmm. If any of the people online or any of our members wanted to get a copy of it, how could they access a copy of your textbook?
Actually, thanks for that question, because it's not just our textbook that we have. We also have a couple of other products and services that are helpful. The textbook you can order online at our website, which is www.fnhma.ca. It's available for purchase, and we have 4 other publications that are available for purchase as well on the website. We have toolkits, and I really wish you could see them. We're really proud of them. They're practical, they're relevant and applicable, specifically on HR programs and support services. We have another one on governance, strategy, policy, and decision making. We have health services integration as well that's been published. And we're finalizing our most recent project on health services accreditation, which will be available later this year on our website for purchase as well.
Oh, great, thank you. I'm going to follow up on another question. You've been mentioning health integration in different ways, through the course, through the work of the daily life of a health director, and certainly your new toolkit. If you were to think forward in terms of, say, there's a regional health authority or a provincial or territorial leader who's thinking about strengthening the relationship, the partnership with First Nations, and this may be a multi-pronged question, how can your organization help? What would be some of the first steps that you would recommend?
Well, I think acknowledging that there's a role for regional health authorities, local health integration networks, and health leaders from across Canada is step one. That there's a role to support First Nations health directors. Obviously, we know the statistics around the disparities going on in First Nation health. So one is recognizing that there's a role to support. I would say that there's probably an opportunity to co-take some of the intensive courses that we offer. So ideally, I'd love one day to see a local health integration network or a regional health authority or a FNHMA regional office actually partaking in the course together to show the true spirit and intent of health services integration.
Thank you. So let me go forward and even ask you another question. And it may sound like I've got all the questions. Maybe that's true. I have so many questions. So you mentioned reconciliation. And I'm wondering what would be the view of your organization right now? We've seen the Truth and Reconciliation Commission calls to action. We've seen a lot of uptake from provincial, territorial, and the non-Indigenous Canadians to ask, how can we help? Is there a way for your organization to enter into that conversation? Say, for example, let's say BC Patient Safety and Quality Council says we want to help with First Nations health and closing the gap. Is there any kind of place for your organization to support that or be involved with that?
Thanks for talking and bringing up reconciliation, Rose. Reconciliation, as Canadians, we've been hearing this, most recently in the news, but reconciliation has been at the forefront of First Nation organizations for a number of years, starting with the RCAP report and most recently on the call to actions. There are a number of health identified call to actions in the recent report, and I think that FNHMA has a large role to play in terms of looking at ensuring equitable access to health service delivery, and also in terms of the education component. Obviously, we're an education organization looking at certification and professional development. So I think anyone who is looking at a lens of reconciliation is also recognizing that investments should be made in First Nation health according to the call to action, but also in terms of ensuring that First Nations can adequately play a role at the tables in negotiating health services, and that for our organization is the first step is becoming certified so that we're on a level playing field and have the same terminologies, and I would say that would be how I would look at us playing a role.
So I think there's a few questions that might be coming in on chat, so I'm just going to continue to ask a few more questions of you. Maybe this might be of interest to some of our members online right now. You've spoken a lot about the relationship between First Nations and regional health authorities and provincial territorial health systems, and you've been quite eloquent in building up that playing field so that there's equal players around that table. Mm-hmm. Are you available to speak to other organizations about that topic? Are you available at keynote conferences? Is that something that you also do, Marian?
The First Nation Health Managers Association looks at opportunity in terms of meeting our mandate, which is certification and professional development. I think there's a larger role in terms of a voice that health directors across Canada have a part in. We do look at gathering information in terms of being able to turn it over to our partner, the Assembly of First Nations, in terms of advocating. So just clearly, I have a partnership agreement with the AFN where we're the gatherers and the grassroots organization, but they play the role in terms of advocacy. So I don't step on toes there. It's a relationship that I value. However, that's not to say that health directors who are on the ground don't have ideas for how reconciliation in Canada's First Nations, specifically on health, can be addressed. So we do talk about the organization. We do share some promising practices that we hear, and we have participated in things that are out of scope in terms of, there was, for example, a recent Hero X challenge. FNHMA participated as one of the judges where we looked at innovative ways to increase First Nation health care delivery, and we actually launched that at our conference. So that was really exciting. The other piece that I kind of draw a relationship to, and I'm just seeing a couple of some of the people that are online today, and I'm seeing some accreditation folks, and I really want to touch on something that we're seeing here. Accreditation, I used to work in accreditation, so it's in my heart as well. But what we're seeing quite often is when First Nation organizations go through accreditation, the number one report coming back is leadership and governance. So in terms of, ensuring First Nations go through an accreditation process, should they choose to, because it's not a mandatory requirement, there has to be investments made around governance in First Nations health. And that's something that FNHMA wishes to address and does so through our workshop and also through our toolkit as well.
All right, well, we're going to move to one last question. And one last question. We are getting close to the end of our webinar. Can you tell me a little bit about the evaluation, and have there been any measures of satisfaction of participants in your training? Can you tell me some good numbers around the level of satisfaction of people who've gone through either your training program or through your certification process?
Thank you for asking that, because that's what makes us unique and different. So if someone were in a community and said, oh, you know what, I should take, this business administration or health course through academic institution X in my region. When we first started, we said, why redevelop what's already out there? And we did anyway, and I'll tell you why. We did an extensive evaluation of what was existing, mapped it against the core competencies that health managers said that they wanted, and the gap that was missing was that there was nothing that was relevant in terms of real-life context and the richness that we touch on in terms of cultural awareness. So an example of our very first assignment number one when somebody comes into our classroom is you have a brand new health portfolio counselor. And for those of you that don't know, health portfolio positions turn over quite rapidly in community. You have a brand new health portfolio counselor. They do not have a background in health, and they're related to the chief. How do you brief them? And this is reality. I know we laugh because it's real. So how do you tell them about your health services at the health center? That's assignment number one. And that's a tool that so many students have said, I actually dug up assignment number one in course 100 and dusted it off when we had a brand new health portfolio counselor. So the richness in which, the relevancy in which we teach is not offered in any other academic institution. So it's the reality of that. Oh, well, before I know I'm running out of time, but one of the other assignments is at the end of the 5 courses, we ask the students to put together an assignment that touches an accumulation of all 5 courses. And one person had lost a youth center in their community due to fire. And it was actually, it was a fire that was intentionally set, and unfortunately they lost the youth center. So through the courses, our student actually put together a proposal to get a new health center. And it was the courses that she used, it was the assignments, and the proposal was put forward, and guess what? They're breaking ground for a brand new youth center in that community. And it's because of the courses that inspired her and gave her the skills and abilities to be able to demonstrate that they needed it. And I have to say, if you check out the videos, I know you guys, you'll have a link coming to you. We do have a YouTube channel. And our YouTube channel is FNHMA, so it's fairly easy. We have a series of 13 videos on there, and if you watch the health directors speaking to health directors, you'll see the students. It's easy for me to say I love the program. I'm a little bit biased, but our students who have actually gone through the program say, where was this 10 to 15 years ago when I became a health manager? Our community could have been so much further advanced than where we are if there was this kind of support in our community, and that it was supported in partnership by not only the federal government but our regional health authorities and local health integration networks and all First Nation partners from across Canada. So when you want to check out that, please go visit the YouTube channel, and you'll see our health directors talking to health directors and a number of other organizations speaking as to why they support FNHMA, and they do so, I'm sure, with more eloquence than I can at this point.
Thank you, Marian. I really did hear a number of really key points that I hope others will be also heard around the complexity of this work. The CEO of Health Services on Reserve has to deal with the depth and breadth of the CEO and sometimes for a regional health authority level. And then added on the complex jurisdiction. There really is no job like this. And if I can go out and just advocate a little bit on their behalf, if there's a way that we can think around how we support this organization as one of the professional First Nations health organizations in order to close the gap in health equity, I think that's all of our role. So I want to thank Marian for this time. Thank you for your excellent, your engaging discussions, for your links that you provided for future learning. You also have her website to get in contact if you want to look at buying any of her products, including workshops, textbooks, toolkits. I just wanted to again remind everybody that this is one part of our new recommended learning journey for Indigenous health. There are 2 upcoming webinars which you may be interested in. On March 21st, the Thunderbird Partnership Foundation, which is Canada's Indigenous mental health organization, is going to be doing a webinar on mental health around hope, meaning, purpose, and belonging, an Indigenous way of thinking about mental health systems. Mental health systems include all of us in health, so that's a great webinar coming up. And on April 5th, Thunderbird Partnership Foundation and Carol Hopkins is also going to go more into depth around why culture matters around Indigenous mental health. There's a couple of other webinars that we will make links to. One of them is Joe Gallagher's webinar that he did on December 1st, so this is just a couple months ago, around cultural competency from the BC experience. I'm also reminded that some of you may have been looking at the number of acronyms in First Nations Health. We also are going to dig up the FNHMA webinar, First Nations Inuit Health Branch overview of their work, which has some links and information about the programs that are available on Reserve. So we'll bring that webinar back online so it's available for the public as well. And with that, I'm going to turn us back to polling. I'm hoping that you will please give us some feedback on today. You have a poll now showing on your screen. Your feedback is invaluable to us for future webinar design. Please take a moment and provide us with some feedback on today's session. We also invite you to think about signing up for our CFHI newsletter. This recent newsletter just went out, actually talked about residential schools. Why does it matter for all of the health systems? So I hope that you will sign up and get access to that information. Once again, I'd just like to thank Marian for her presentation today, and for Sheena, Kelly, Joanne, thank you for helping making this all look so seamless. And thank you to all of you who signed up today, and a safe drive home for those of you in Ottawa, Toronto, Montreal. It's a bit messy, but that doesn't conclude today's webinar. Thank you and have a great day. Thank you very much.